So I'm going to invite Dr. Radha for the second case.
So our next case is about Mr. K. He's a 35-year-old electrician who's working for a large private engineering company for the past 10 years, who recently developed neck pain. He was referred to an orthopedic surgeon by his doctor, and radiographic examination performed showed that he had some abnormality, some degeneration of his cervical spine or his neck spine at multiple levels, which was very severe at 2 levels. And then he was referred to a physiotherapist and given some medication, some anti-inflammatory drugs. He had repeated visits to the doctor and the physiotherapist, but he really didn't feel any better. At this point, the orthopedic surgeon saw him again and gave him 2 choices. One was to consider fusing a couple of his vertebrae, which would definitely limit his neck mobility, which may be a significant occupational problem for him. The other was to consider placing an artificial disc, but he would need to pay for the artificial disc because his insurance wouldn't cover the cost. So Mr. K thought about this, and he figured that he couldn't really make a firm decision at this point, and he wanted to take more time. And during that time, he requested to continue to go to physiotherapy to see if he could gain any improvement. The orthopedic surgeon did not think it was appropriate, and the physiotherapist also refused to consider this because he felt that Mr. K had made limited progress. Mr. K then went back to his own general practitioner and requested a referral to the other orthopedic surgeon. But the GP also felt that the original orthopedic opinion was professional and appropriate, and that Mr. K was wasting time. Ms. Chan was a nurse in the GP's office, and she actually had been with this GP for about 10 years or so and knew this patient very well. So she suggested that she knew a chiropractor and that Mr. K should try the services of this chiropractor, and that many other patients she had referred to the chiropractor actually did much better. So Mr. K thought about this, and he decided to go to a chiropractor while he was making a decision about what surgery should be performed. Of course, both the GP and the orthopedic surgeon were very unhappy with the recommendation given by Ms. Chan because they thought that Ms. Chan was unprofessional and that she had overstepped the boundaries by interfering with the doctor's advice, and they also thought that seeing the chiropractor was not in the best interest of the patient. At this point, I'm going to invite our panelists back to the stage. And I'm going to start by asking Ms. Dorothy Chan, our nursing consultant, a professional consultant in the nursing school. As a nurse, as in the nursing profession, how do you feel about the opinion that Ms. Chan actually gave Mr. K? Do you think that she was obliged to give this opinion? Was it her duty to give this opinion? And how would you have reacted in this situation? Maybe we'll give Ms. Chan a few minutes to gather her thoughts also. Meanwhile, maybe I will address my next question to Dr. Campbell, which will help put this into a little bit of perspective. Dr. Campbell, how do you feel about this whole case? Where do you think the fundamental problem of this case lies?
Well, this is a really difficult one. I actually find it difficult because it seems easy. So it seems to me like the GP is right in the opinion that the nurse oversteps professional bounds. Hopefully Ms. Chan will explain the professional roles of nursing in a little bit more detail to explain why that should be. Yeah.
Dr. Rump, any thoughts on this case?
Yeah, so I think we have to ask our question, why did it come to the situation that the patient went back to his GP asking basically for help, right? That is because he was given 2 choices, of which one didn't look good for his occupational future, and the other one didn't look good for his purse. So had he been able to make a decision, had he been guided in the first place to the right decision, have he been given help to come up with an opinion on what kind of surgery is best for him, maybe he wouldn't have come to the situation where a helper in this private rooms of his GP gave an opinion and possibly overstepped the line there. So I believe the crux here really lies in the process he went through when his orthopedic surgeon suggested a surgery.
I completely agree with Dr. Rump. I think one of the main crucial problems with this case is communication. I think definitely the first step of communication in terms of offering the patient two very difficult choices to choose from should be one that is navigated very carefully. Is there anything else about the communication that we could have done better in terms of, the repeat referral to the physiotherapist, whether or not giving the patient more time in a different manner would have helped him make the decision better rather than rush to choose other options? Any opinions from the panelists or from the floor?
So as insurance was mentioned, right?
Yes.
Not
I have
paying
that question
for
actually for
artificial
you coming up.
I think it seemed to be a foreclosed idea that insurance companies are stubborn and just don't pay. If there is a need to pay for them anyway, they may as well consider. So it might have been a way of saying to Mr. Kwan, yes, maybe your insurance company at first glance will not pay, but if you may as well talk to them and try to find out, and maybe they may change their mind. It's an interesting discussion about experimental medicine and medical treatments. We are often faced with, and if I may digress a little bit, but just to put some color around this, we are often faced with particular cancer patients who, where basically they run through the whole process and still the tumor is progressing. And they read something that in the United States there's someone who has found a solution and they can treatment. And then they come to us as an insurer and ask, well, so you covered me until now, would you cover this bit as well? And it's a tricky question, right? And I'm not saying there's a good answer to that. But I think insurance companies more and more come to the notion that in the interest of their insured, it might be something to consider, and they consult then with oncologists and so. So in that context, I believe, again, communication was probably a bit too rushed, right?
Yeah.
Maybe there was an opportunity to go back to the insurance company and say, look, this would cost you 50,000. A fusion would cost you 50,000. It's probably much more, but just for example sake, and the artificial disc is 60,000. Can we make a deal?
Yeah. And even assuming that, the insurance was one issue, coming to think of it, actually after Ms. Chan suggested that there is a chiropractor who might be able to help, the patient was actually willing to pay. So, maybe if this conversation was held and the options were discussed, he might have been willing to pay by himself for the physiotherapist's time. So I think, again, coming back to the point of communication, that's a very important issue. Now, Ms. Chan, I think, was definitely trying to, in a way, act in the best interest of the patient, to help the patient participate in his own decision-making process about his own medical care. But then there was some conflict of interest, and here I don't really mean financial conflict of interest, but in terms of competing interests between the patient and the physician. The physician is of the opinion that further physiotherapy or a chiropractor's input may not help, whereas the patient thinks it may help. So she's sort of in a bind. She has a conflict of interest between two parties that she actually has a relationship with. So whether or not it is her duty, or whether or not how best she could have handled the situation to facilitate this patient's care, maybe Ms. Chan, you might be able to comment.
I have just a quick point on this, which is having thought about it a little bit more. The point you make is really valid, that there may have been communication issues with the decision-making process. So I suppose there are, in fact, 3 options open to this patient. There's the option of the fusion or the artificial discs, and then the third option is doing nothing. And it may be that the patient hasn't been fully made aware of the relevant risks and benefits of the various options available to him. It seems like the patient is trying to find a 4th option because they're not taking or not trusting the doctor's diagnoses. And that could either indicate that a real problem in the system, that the patient feels that they need to fight in order to get the best outcome for themselves. Or it could indicate just some patients are really stubborn and you can have a decent system, but they just refuse to believe. They just refuse to believe. So it could be one or the other. And the case may be a good moment to reflect on, that.
And I think the patient comes back to the GP asking for a second opinion from a different orthopedic surgeon. And even if the GP has full confidence in the original orthopedic surgeon, would it or would it not be appropriate to offer this patient a second opinion? I mean, that's another question. Probably if this patient spoke to another physician who was also an expert in the field, which gave him similar options, it might be easier for the patient to make a decision as well.
Right.
So at several levels, it seems that the communication has been lacking. So maybe I will ask the audience, what do you think about Ms. Chan's decision? If you were in her position, would you have advised the patient to go to a chiropractor? Yes for green, of course, and no for red. Okay, Dr. Lee says no. Dr. Lee, why? Why? Okay, who else says no? Okay, Professor Gupta says yes, so let's hear why he says yes.
But what about the others? I haven't seen. No.
Okay, let me see.
Let's
Yes,
raise
please.
again. Yes, no.
Sorry, I don't know your name yet. I'm sorry.
Okay, because I know the resolution of the case.
Okay, so
I-
we'll.
Maybe I introduce myself. I'm Abraham as an emergency physician. We come across similar situation quite often in emergency room when specialty clinic management has not yet demonstrated the expected efficacy or effectiveness. What we come across a lot of situation is, well, we have different capacity when we perform our duties. On one hand, I am a doctor, but on the other position, I can be a general public. But for Ms. Chen's case, it all depends on how she expresses her opinion in the capacity of a nurse or as a general public. Even though these days we talk about evidence-based medicine, however, we notice that evidence-based medicine still have its own limitation, and the number of topics that has been fully explored is not comprehensive enough. So we can't exclude all other possibilities, except for some ritual or the other management that most of the people in the society will regard as a harm or useless. For those circumstances when the patient have negative view on the management plan proposed by the physician in charge, alternative treatment should be respected. Whether you will say it is work or not is another issue, but the patient should be able to recognize some other modalities is possible. However, they have to be informed that this is not scientifically proved. By personal experience, some people say it works, but some may not. I think that's important if you provide the comprehensive information, because for Ms. Chen, she should recognize that she has dual role at that juncture of time. And if she does not clarify by what capacity she's making the statement, that will be a risk. The patient will understand what she suggests from the professional perspective. That's very dangerous. Thank you.
I completely agree with you. I think it's definitely, there's a professional versus a personal perspective, and in the doctor's office coming from a nurse, it is very likely that the patient will take this to be a professional opinion. And it also raises a whole multitude of other questions about the ethical implications, the legal implications. And remember, this is not only for the nurse, but it's also for the doctor and for the entire practice. And I do agree we should respect alternative methods of medicine, but in the event that we are not qualified enough to know the pros and cons of this, we may have to exercise judgment in how we present these to our patients. Another question is the issue of collaboration, in that if Ms. Chan truly wanted to raise this possibility to the patient, given that they are a team working together, physicians and nurses, would it have been more appropriate to have a conversation with the physician first before offering this opinion to this patient, and maybe not just this patient, but other patients who are coming through the door? Dr. Lee, yes.
I still have to say something on this. Now, I think we have to go back to the questions what the patient asked for. He's asking for a second opinion for orthopedic consult. Now, as the nurse, I think I also agree that the nurse also consider the GP is not doing the right thing, because every patient has the right to ask for a second opinion. We should refer the patient to see a second orthopedic surgeon. But if the GP is not doing that, I think the nurse is doing the right thing to help the patient. But in response to his request is to see another orthopedic surgeon. Then the nurse should actually help the patient to find the way to see another orthopedic surgeon. In Hong Kong, it's so easy. You can just ask him to go to which building, commercial building. There are lots of orthopedic surgeons there. She can choose anyone she likes. But rather than having advice on another treatment that the patient did not ask for. That is my view why I think this is not the right thing.
Yes, Dr. Rump.
That reminds me of something. There are insurance covers now that offer as a benefit a second medical opinion. So if a insured is diagnosed with a disease, they can have their stuff, their evidence, sent to the Mayo Clinic or Harvard or so. It's an American idea, right? So to one of these super centers of medicine, as they call themselves, and it's interesting, this cover is very cheap, by the way, is not being taken up in Hong Kong. So very few people buy it, and if they have it, they don't use it. And we ask ourselves in scratch our head, why not, right? Sounds logical, right? You're diagnosed with a degenerative disc in your neck, it hurts like hell. Of course you want a second opinion if you have choices, if you're given choices. People don't do it, we believe, because it would be disrespectful to their physician to ask for a second opinion. So what you've been suggesting, just go to another commercial building, would be probably even worse because they know each other, right? These orthopedic surgeons. So it's if there's an element of that, right, that really has an impact on the or is a result of a more twisted relationship between a doctor and a patient. If they don't go for a second opinion because they don't want to look disrespectful to the opinion of their doctor.
And perhaps on a very tangential note, and given that we have a lot of medical students in the audience, my own personal perspective is perhaps as physicians as a community, we should probably open up a little bit more and be more open to these questions from our patients so that we can actually facilitate this process. And in fact, the patient may get a second opinion and end up coming back to you because of the trust that you have developed over a period of time with the patient. But I think the sense of openness and communication would definitely take the doctor-patient relationship to a second level. Yes,
I'd like to. Oh, sorry.
Sorry.
Just,
No, go ahead.
I'd like to hear a nursing perspective on this, because the nurse has been kind of quiet.
I actually agree with Dr. Lee. Your advice on for nurse, it may not be so appropriate to give another advice on or ask the patient to for another treatment. But of course, we sometimes really give another options. But I'm thinking if during that situation, how the nurse communicate with the client. Yes, because some clients may think that they're so hurry in discussing the situation or the options with the doctors at the first moment, and they want to sit for another advice, and then the nurse probably in this case is the third or fourth advice already. And as nurse, I believe we would like to talk more to our clients. And so the tone of voice or the communication methods may be one of the influencing factors that affect the final choice of our clients. And sometimes we want to explore more about their values and beliefs in the choice they're going to make. And so I believe some hidden things that we don't know in between. So I think it's difficult to answer whether it is acceptable for the nurse to do the advice on the client.
I think it's a very interesting perspective that Ms. Chan brings up, in that she actually had a conversation with the patient and the patient finally chooses the option she provides, which clearly suggests that, you know, communication is a central issue.
Okay, one hidden thing was actually Ms. Chan also advised him to go to an orthopedic surgeon first, and he refused. He refused to go to another orthopedic surgeon by the time, and then she actually advised him to go to a chiropractor who she knew well. And I think at that point the question is, and I agree with Abraham, this is now more a decision or something grounded in personal belief rather than as because she doesn't have the professional capacity to advise where. And I think it's more, and this role of dual or multiple capacity we often play. I think we must understand we often play this role, and sometimes we say, I'm not the best qualified, but this is my belief, and people will take you for your belief because they know you've tried it. And sometimes things like experimental therapies off-label treatments may or may not work, but it's your belief. And I think the distinction has to be there. Is she acting in capacity of her duty, or is she genuinely feeling that, okay, there's an option? So
Well, I think most of the remarks have already been made, and I wouldn't spend a lot of time on the closing remarks. But basically, I think the nurse did try to put the patient's interests as the primary objective. Of course, there is an issue of conflict of interest between different parties, and how best to collaborate with all the parties, how best to efficiently enhance communication to make sure that the patient is served well and the patient's needs are met, I think is a very important question to answer. I thank you all for giving me this opportunity to present the case, and thank you to the panelists and the audience.
Finally, what happened was the patient did go to the chiropractor, eventually had a spontaneous fusion of a natural fusion, and did not need any and he continued actually work with the public organization. Very happy bloke.